With Social Security disability, people that have mental health issues think that, well, I just go to my therapist, that should be enough. Unfortunately, it's not. This is because Social Security only accepts medical evidence from what they call acceptable medical sources. What's that? Well, I could go through all the designations, and there's a lot of them. It's just, if the person that's treating you can prescribe you medication, they're an acceptable medical source. The problem is, a lot of times, people's counselors are not acceptable medical sources because they're mental health therapists or licensed therapists or clinical social workers and not part of their criteria. So remember, they have to be able to prescribe you drugs or be a doctor, have a doctorate, a PhD, a PSYD, which is like a PsyDoc, okay? Those are the only acceptable medical source. So a lot of times what people do is they just see their therapist. You also need to see at least your PCP, somebody that's going to be able to prescribe you your meds, or be able to look at the therapist's notes and say, yes, they're getting acceptable medical treatment. Now, I know you're going to sit back and say it's not fair, and I don't think it is either. These therapists are wonderfully helpful. They're knowledgeable. And a lot of times when you're seeing a psychiatrist and the therapist knows you better than your psychiatrist. Or psychiatrist, you just see 3-6 months, get your med checks. But really the work you're doing every week is with your therapist. I understand that. But Social Security's rules are such that you keep seeing your therapist, but you need that psychiatrist to let Social Security know that the therapist is doing the things that are right. So your therapist is awesome and your therapist helps you. So how do we get their records to the judge? Well, by going to somebody that is like a medical doctor, a nurse practitioner, a physician's assistant, somebody that can prescribe you medication if needed and can look at the notes of the therapist and say, I agree with the course of treatment. So remember, if you're just seeing a therapist and no other medical provider for your Social Security claim, you're going to need to see somebody else, even if it's your primary care physician.